Welcome to the Asking for a Friend podcast, where we bring the experts from Donaldson around the table to explore everything from health and lifestyle to skincare and appearance. We're kicking off this podcast series with our very own Dr. Donaldson, a board-certified plastic surgeon and owner of Donaldson, a healthcare practice that uses functional medicine, plastic surgery, aesthetic treatments, and med spa to help patients achieve their health and wellness goals and feel confident from the inside out. I'm super excited to hang out with Dr. Marguerite Weston and Nikki Rucinsky, who I also have the pleasure to work with. Dr. Weston is a double board certified functional medicine physician who began her own health journey as a functional patient. And Nikki is a medical esthetician and guru of all things skincare. Great to have as a friend, by the way. Today we're diving into everything you need to know about breast augmentation and sharing our own stories. We cover implant safety, how to find the right size, it's always a huge question, and my personal favorite debate, can breast augmentation actually save you money in the long run? And yes, it can. Let's dive in.
All right, guys, cheers.
Cheers. Here we go. Thanks for having us, Dr. Donaldson.
Yeah, thanks for coming.
Liz was with us earlier and was gracious, and we had wonderful drinks and talked about really interesting things. And one of the things we're going to focus on tonight are breast augmentation, and kind of like combining a natural lifestyle, holistic lifestyle, and like for the women that still want to get breast implants and feel more confident, and how do those two like marry?
Great.
And like both your perspectives from a functional provider and a plastic surgeon, it'll be perfect. So.
Yeah, so I'm glad you said that because I'm actually asking for a friend. I do have a friend who's been wanting to get a breast aug, but she is worried about like how she's going to feel after. If she's still going to feel like herself, if she's going to feel natural, if she's going to be, judged for having these implants. So I want to know like what you guys' takes on are on that.
Sounds great. Let's talk about it.
Let's hear it.
So I think like, who cares what we think?
Yeah.
As far as like what natural is for the person or the woman. I mean, natural is your own definition and how you feel.
Yeah.
And I think you have to feel confident, and that's natural, right? Like, sure, it's natural if you have multiple children, your breasts are saggy and don't look like, but if that's not how you feel confident,
Yeah.
like if your natural is your 25-year-old breasts, then that's your natural.
Yeah.
Like I think everyone's kind of on a different journey when it comes to that.
I think like the concern really comes from people are just trying to be natural with like, right, their food. They want to eat all natural food and have all natural skincare and lead a natural life. And I feel like just putting those foreign bodies into your body, some people are like, well, I'm not natural anymore. I'm cosmetically enhanced. And so I think that's just like a concern that people are dealing with right now.
Yeah, I mean, I think it's legitimate. I mean, breast implants, fortunately, are made of really benign materials. So there are saline breast implants, which literally are salt water. So for patients who are really concerned about the contents of an implant, oftentimes they'll choose saline. And literally, if it ruptures in your body, it's like drinking a Gatorade. It gets absorbed by your tissues and it's hydrating.
Never thought
so
of it that way.
it goes flat, and that's the risk. But that is one of the most natural substances we can take in. Silicone is also a natural substance found in sand, right? And so it's manufactured, but it's ubiquitous medical substance. And when patients have knee implants or heart valves or hip implants, there's a silicone lining or silicone coating, and we know it's inert and it stays in the body and it gets kind of walled off by your natural tissues. And it's a foreign body, like a splinter or a thorn could be, but it just gets sealed off and kind of undisturbed. So I think if it's really a legitimate, just something someone can't get over, it may not be right for them, and that's fine too.
Absolutely. So
Go ahead. Oh, I just heard, we were talking about I've heard they're the most studied medical device. Is that true?
They are. I mean, 10, 15, 20 years ago, they were actually taken off the market, studied up and down, and I think millions of patients went through the studies. Thousands and thousands of surgeons participated in those studies, and they found that the things they were concerned about, namely which are autoimmune diseases, just weren't scientifically linked. And so they were brought back to the market. Interestingly, during that whole time, they were left on the market for breast reconstructive purposes. So patients who had had breast cancer, who had had mastectomy and needed their entire breast rebuilt were always had silicone as an option. But when it came back out for aesthetic purposes, the FDA asked for a couple of changes to be made, and so the shells became a little bit thicker, so they're less prone to rupture. And the inner silicone, I think more importantly, was more cohesive. So before, if you punched a hole in an implant 20 years ago, it would just sort of goo out all over the table, but now you can actually cut it in half and have two halves. So it's more like a gummy bear. So even if it gets torn or ripped in some way, it really just clings together as a breast implant and doesn't go anywhere.
So with those changes, do you have to have MRIs?
The FDA does still recommend you have MRIs, so every 3 to 5 years. Some patients are really consistent with that. Other patients aren't. It depends. The textbook answer would be to remove a breast implant if it's ruptured, but oftentimes a patient won't know. It doesn't leak into their body. It doesn't go into the bloodstream. It doesn't pose a risk in that way. And so if there's a suspicion, if it looks different, if it feels different, we sometimes will go ahead and encourage that patient to have an MRI and find out for sure. But chances are, with the way they're made, there are YouTube videos of cars running over them, and they're really almost indestructible. And we have patients who are competitive athletes and jumping out of airplanes and doing things with safety and without any effect to their implant. So,
How often do you see a ruptured implant, like in your career?
I've seen several dozen from the old days, back when the implants were less sturdy. I can't say I've seen any since the changes have been made.
Yeah.
How long ago were the changes kind of put in place?
Yeah, it was the big changes were probably around 10 years ago.
Yeah, that's funny because I had mine done 11 years ago and I had a rupture. So that's
Nice.
perfect.
What did you do to cause that? You have to do something pretty heroic.
Yeah, so I was training because I used to compete for bodybuilding. So I was about 2 weeks out from my first show. I was training with a military guy. He was helping me through my training, and we were doing these crunches with a medicine ball, 15-pound medicine ball, and he was throwing them at me, like all his force. And we were talking while we were doing it, but I was catching it as I would crunch and come back up, and then I just wasn't paying attention, didn't catch it, straight to my chest.
Oh my gosh.
Wow.
Wow.
It was great.
Well, it's a good thing your implant ruptured so you didn't break a rib.
Exactly. See, it was a cushion. I needed it.
Yeah.
It could have been a lot worse.
Saved you.
So I'm on the opposite end of that. So I was right at the change. I was probably around 20 years ago when I went to get mine, and they just had they pulled the old silicone and they had like a different version out, but I had to like get them checked a lot and like be part of like a study, or it was something weird. So I just opted for the saline just to play it safe. And I mean, they've lasted, I know I'm gonna jinx myself, knock on wood, for like 20 years now.
Yeah.
But I'm just like waiting for that to happen, and I'll 1,000,000% get the gummy bear, like without question.
And that's what they say. The rupture rate is about 1% per year.
Yeah.
So if you've had them 20 years, the odds are you've had a 1 in 5 chance that one of them would have ruptured. But if you're beating the odds, then that's great.
I know.
Yeah.
I had a patient, probably a month ago, and who had saline, and she goes, literally, I rolled over in bed and I heard, and it just went, go great. I know that's going to be my life, and I'm sure I'll be on vacation some inopportune time that is going to happen, and I'll be like, I have like the nice turkey breast, and then the sad old mom breast. I'll have to get those little chicken cutlet things.
Yeah.
I should take them on every trip or anything important I go on in case it happens.
Oh my gosh. It falls out of your suitcase like that. Don't ask.
Yeah, I use those a lot pre-augmentation. So.
Oh yes, me too.
Yeah, but I will say, healthy lifestyle is important to me. I've been seeing a functional provider for probably close to 20 years and see Dr. Weston now, and it never stopped me from not feeling, healthy. And I think you kind of pick the things that really matter, and I just was never really scared of it, like you said. There's silicone and so many other things that we put in our body. Even people that are afraid of silicone implants, and they want saline, I always try to talk to them about just how durable the silicone are, and that they have to remember, and correct me if I'm wrong, but the shell of the saline implant is made of silicone.
Exactly.
So you're going to have silicone in your body regardless. So I'm like, you might as well get the durable version that you don't have to worry about rolling over one morning and losing it, right? But I feel like it's never prevented me from feeling less me, or it's made me more confident. It's, in so many ways. And I obviously, when that happens, I'll get them done again. So it's something that I don't regret at all. And very happy I did it.
Most women aren't getting them so they can have attention.
Yeah.
No.
I didn't want anyone to know.
You just want to be able
that's
to
exactly how I was.
put on clothes and be able to try things on.
Yeah.
I think that's what people are most excited about once they get them, is they want to go try things on. They want to go
I did it for me when I did it. I didn't do it for anyone else. I wanted to feel more confident, more comfortable, but I was really nervous when I got mine done initially because I lived in a really small town at the time. I was the only person in the town that had ever had plastic surgery done for anything. Like, there was no Botox, there was no fillers, there was no nothing. And so whenever I got mine done, I was nervous that, it's a small town, everyone talks, that everyone's going to be like, oh, did you know? Did you hear? But didn't experience that, which was great, but I also was very always covered, and like I didn't want anyone else to really know for a long time because I didn't want that judgment or like anything like that. But honestly, there are days that I forget I had it done. Like I just feel so me. It's just part of me now that
I can't imagine not having it.
I think most patients too, when they ask for something natural, they're wanting a versatile look. And so Friday night, if you're out with your partner and you want to have a nice evening, maybe things are a little bit different than Monday morning when you want to be a little more subdued. So I don't think it depends on, natural is in the eye of the beholder. And I think if someone wants something that's less obvious in certain situations, then that's entirely doable. Fortunately, we have a vast array of implant models and sizes and shapes and forms, and so we can really customize that and tailor it to each person's individual concept of what they want. And I think it can be quite natural. A lot of that has to do with, and some patients frankly don't want it to be as natural, and that's okay too. That's a choice, and so that definition's different.
They rock those things. They're like pumped about them. They're like, woo! Like, they're fun.
As they should be.
We see all different types.
It makes you comfortable and confident. Rock it, girl.
But I love the approach like we take, and I always talk to patients because they'll come in the office after they size and they're like, I'm so worried. I don't know like if this is going to look great on me. And I'm like, well, we have this down to a science, and it's not like we throw you in a room with every implant from 100 cc's to 800 cc's, and we're like, pick what you want. Like, there is a science behind what's going to fit you, and you're great about like, I'm going to measure you, and then we're going to hand you like a range that's going to like suit your frame. It's going to look great. You can pick a moderate profile or a high profile, and you're going to try them on, and you're going to see what you like. And I always just say, go with your gut. Like, go with what you tried on. Don't look at pictures of, oh, here's somebody with the same size I have, but I don't know, because it's going to look different on everybody. And it's so hard to explain to people.
Patients come in with different ideas about what they want in size, and they might even bring inspiration photos, which are helpful. But everyone's so different. The rib cage is shaped differently. The way the muscular anatomy and the pec muscle originates in the shoulder and inserts onto the breastbone, or how far apart the breastbone splays. It's just, it all factors into what implants we choose. And so I think it's important to give a variety and to say, take measurements and be scientific and say, here's a spectrum of implants that you can try. None of these are going to be out in your armpits. None of them are going to touch in the middle. But within that spectrum, you get to choose. And it's fun because they might bring their partner in, or a friend, or someone who's had it done, a sister, and they can look in the mirror, and they might bring a bikini and a dress and see how that works. But I think that natural volume is what we're after, particularly patients who have lost a lot of weight, they've had pregnancy, they've breastfed, whatever the case may be in their life. It flattens that upper chest and that upper pull. It's where we see it the most. And to give that shape back, to not have that gap when you put on a pretty bra that you're trying to fill with something else, to naturally fill the cup is kind of the goal.
Speaking of that, it reminds me of patients. We've had patients come in their bridesmaid dresses to try on. I got to see what this is going to look in my bridal gown and my bridesmaids dresses. I had two sisters in today that were literally cackling. Did you hear them earlier? Cackling. I heard them down the hall, and I'm like, you guys are having so much fun. I'm like, I'll just come back later. Just keep going, And they were both trying them on, and the sister was there to support the other one. But I have a feeling she might be in soon. But it's really cool. It's such a fun appointment for sure.
We've had every combination, sisters and mother-daughter, and best friends, and every combination. It's fun. It sort of catches on.
When does like a lift come into play? Because friends ask me that all the time. Like, I really want to get an aug, but I don't know if I need a lift. Like, how do you know if I need a lift? Is it the pencil trick? Like, you get that all the time.
Yeah, there are different degrees. We call it ptosis, or different degrees of sagginess of the breast. And it just depends. Everybody, again, is unique and different. For patients who have the most severe forms of ptosis or sagging, and the most extreme example, if the breasts are down to the belly button, it's pretty obvious you need a lift. You can't just add an implant. It's just going to make everything really heavy and even saggier. So we do some tests in the procedure room and take measurements from the base of the neck to the nipple, and we take measurements from the nipple down to the breast fold, and we try to determine how much sagginess sagginess is there and whether a lift would be appropriate. Within that spectrum, there are a lot of lifts that are possible. Some patients need a mini lift where we just make the incision above the areola. Some patients, it's all the way around the areola. You get a little bit more power if you add that vertical incision. You get a little more power if you add that horizontal incision. And so we have a lot of tools and a lot of techniques at our disposal, depending on how lifted a patient wants to be or how lifted maybe they need to be ideally.
Do you recommend doing those at the same time, or do you recommend doing like one before the other?
Most often, I think it makes sense to try and do them together. It's a lot of variables to consider, but we fortunately have a lot of experience doing that and are very successful at it. And there are some cases if patients have really quite heavy breasts and quite low breasts, maybe we'll do actually a reduction with a lift and then suggest staging that and going in and adding an implant later. But that's the minority of cases. Generally, we're able to do them together.
Do you find, like, have you seen patients come into your practice that have complained or just regret getting their implants or think it has anything to do with like health issues or anything like that?
For the most part, no. For the most part, people are very happy. I have seen some patients who have gotten them out. They have questions about removal and the capsule. They feel as though they have had changes in their health because of them. And so I think, some patients feel better when they get them out and some patients don't.
Yeah.
And so that's hard. That's really a diagnosis of exclusion. When people come in and they don't feel well, I don't, go straight for the implants. And I'm like, well, do you have implants? Well, that's why. I mean, I think that's sometimes an easy thing to blame. We first look at testing, and same thing we do with all of our patients. We look at lifestyle and exercise and diet and lab work and things before I would say get your implants out.
Yeah. That's been like my experience too with patients that have removed them with concerns. I think one of them thought that they felt better after removing them that I can remember having spoken to. And then like we just had one recently who did it for that reason and was like, I feel no different and wanted them back, so she was coming to get them back. Back. She's like, I shouldn't have done it. Like, and I want them back. I miss them. So you kind of get like every end of the spectrum, right?
Absolutely.
So.
Yeah. And breast implant illness is a hot topic right now. That's probably a discussion for another time.
Yeah.
but I think, what's important to note now is that there's been no scientific evidence that links breast implants to any disease, whether it's autoimmune or other issues. So I think you're right. I think if someone really has it in their mind that the implants are the cause, and they've looked at other explanations and they're just not there, then it's probably reasonable to take them out and see. Some patients feel better, some don't. So hopefully we'll understand that a little better at some point.
Agree. I'll speak to you about this. You're too young. So you haven't had to do a mammogram yet, have you, with implants? Oh my gosh. So it's not fun, but it's doable. So let's kind of speak to that, like breast health, and like once you get implants, are there limitations to that? Does it do anything to disguise like potential, like seeing cancer or anything going on?
Yeah, I mean, I tend to place most breast implants under the muscle. So with mammography, it's important when you tell the mammographer I have breast implants, because they'll actually do one extra view that's an addition to the standard 3 views. So they'll do a 4th view. And when they do that, they can see the breast tissue. And so by going behind the muscle, they're really able to see, if anything, it pushes that tissue more forward and it gives you more of a template to sort of smash the breast tissue against so that you can see that better. There's actually been a study that suggests that patients who unfortunately get breast cancer, those with implants are likely to find it sooner. There may be a little bias because I think patients who have had breast augmentation and are a little more aware of their breasts are looking at them more, maybe feeling them or kind of doing self-exams more. But I also think that it splays that tissue a little better so you can detect something sooner potentially. I don't think the American Medical Association is going to suggest at all that prophylactically get breast implants to prevent breast cancer, but
business would be great.
Apparently it doesn't hurt.
I love it.
Yeah.
Now you were mentioning to me earlier, or had a patient ask, I can't remember, about other forms of detection other than mammogram that are kind of popular through like functional medicine and that.
Yeah, so some patients will ask about thermography. And so they're very different. Thermography just looks at heat sources in the breast. And so it's not recommended that it should not replace mammograms. Some of my patients will do every other one just to not have as much radiation, but I mean, you get the same radiation flying across the country in a plane that you do from a mammogram. So I would not recommend doing it instead of a mammogram. Some patients may do it like at 6-month intervals to make themselves feel better. The current thought is that you actually have to have a pretty large breast cancer to see it on thermography, and then the next step when you have the positive is to do a mammogram. So if you can't see it on the mammogram, like they're not going to biopsy based on your thermography.
Interesting. How does the heat work? Like, is cancer like warmer than like your natural
it's
breast?
just yes.
Okay.
And anything could be infection, could be anything.
it.
It's not specifically cancer.
Got it.
What about, I know we're starting to offer Gallery to patients, sort of looking at early detection. Is breast cancer covered and seen well in those?
So yes and no. So it actually detects more aggressive forms of breast cancer better. The Gallery does, but as far as like kind of the typical breast cancer that we're actually really good at detecting and really good at treating, it's not good at detecting. So it's nice because if you have a family history of more aggressive cancers, then Gallery would be a great option for multiple forms of cancer, over 50 kinds, not just breast.
That's amazing. My friend actually just asked me about that because they saw that we had posted about that. So how does that work exactly, and what does it look like?
So Gallery testing looks at DNA. So it looks at DNA, but it's not a genetic test. And I think that's one like confusing factor for patients. It doesn't tell you if you have a gene or not. It's actually looking at the DNA. And so DNA that's associated with cancer has certain tags on it, so certain methyl groups, and they're in certain positions on the DNA. And so they've looked at millions of samples, and so they look at DNA that's outside of the cell, and they compare it to tons of samples of cancer DNA, and they compare it. And so it is really great at finding cancers that we're very bad at finding right now. So if you think about it, we only have colon, breast, cervical, prostate, and lung. Those are our 5 screening tests for cancer. And there are many, many more. So things like esophageal, pancreatic, ones that are, much more aggressive, much higher mortality rate. So it's good at detecting those kinds of cancers. So people who have either family history or just increased risk themselves, they're over 50 years old, then Gallery is a good option for them.
Cool.
Awesome. So I actually have a friend who was asking me this the other day. She's kind of torn between if she wants to get implants or if she just wants to do a fat transfer. So like, what would be the pros and cons there?
Yeah, in general, it's difficult to get an implanted type of result from fat transfer. It's very hard. Most patients, frankly, don't have enough fat to transfer to make the difference that they want. Those who do, sometimes it takes several sessions. About a 50% fat graft take is considered a good take, and so you may get a very subtle result and want to repeat it once, twice, 3 more times. There's the additional issue, which we've kind of started to figure out with screening, but it used to be that, particularly with the calcifications that you see after fat grafting, they can kind of be mistaken as an early cancer, or at least something suspicious on a mammogram, which leads to further testing, whether it's an ultrasound or an MRI. So any confusion over whether there might be a lesion isn't great. And the final thing would be that just the look doesn't tend to be. So I think fat grafting has its place. Sometimes it can be used for an lumpectomy defect or someplace where someone's had a biopsy and there's a little bit of a divot, and you can kind of fill that in, round that out. But in general, a true augmentation through fat grafting, I don't think is as good of an option as an implant. Further studies are being done. I know a lot of surgeons are trying to gain more experience with it, and that may be something in the future, but it's not something I necessarily recommend now.
Yeah.
Can you make them symmetric?
Yes. Most 98% of women are measurably different from left to right anyway. And so I think the subtleties that it's Bobby and Carrie always say they're sisters and not twins. You're not.
Oh my gosh, I love that.
Yeah.
It's just like eyebrows.
Yeah.
I love it.
So it's yes, you can make them more symmetric. Perfectly symmetric isn't necessarily always the goal. Many of our patients come in and they want an operation, but they wonder how can they optimize their experience. They want to be hands-on participant in their result. So I'm super excited to have you in our practice offering functional medicine, because there are a lot of patients who want to learn about supplements. They want to learn about what are the variables they can control to have the best outcome. What do you tell them when you meet in consultation?
So I think when we have a patient who the goal is surgery, we talk a lot about just pre-op, what you can do to prepare to heal better. And so a lot of it is going to be around diet, obviously no smoking, limiting alcohol, We talk about exercise. We'll go over some supplements, especially if we have patients who really don't want to use any kind of pain medications. We'll go over other options for them. I actually love talking about breast. If I ever have an option, like an opportunity to talk about breast health and hormones, I love talking about it because I think we just think these breasts are just appendages, but they're like living things. I mean, they can create milk, they feed humans, and so hormones are really important. And so I like talking about breast cancer risk, family history of breast cancer. We talk about hormone detoxification, cystic breasts, really common. So there are things you can do to decrease that. And so I kind of use that opportunity to, anytime I can shift a conversation to hormones, I try.
What about, and I think that's helpful before, is there anything after that you tend to cover that's important?
Yeah, I mean, it's much of the same. It's a lot of diet.
Yeah.
I think people underestimate how diet helps, and that's mostly protein, and protein is super important prior to, but then, I mean, afterwards as well, but mostly before.
I think another important thing too is building up that immune system, that immune response for the healing process, making sure, you know, again with diet, but, you know, using certain supplements that can help with our immune system.
I think patients will tell us, like, it's part of their pre-op plan, like, do you normally have nausea afterward? Do you have trouble sleeping? So we can deal with those things too, just with supplements and different recommendations for them. So. And
I feel like we're blessed to have you in our practice and our skincare program as well. And I have a lot of patients who say, you know, what can I do to optimize my skin, my scar? It's not preventing stretch marks, particularly with breast augmentation. When I get stretch marks, when they meet with you, either before or after, kind of what are the things that you like to tell patients?
Yeah, so I mean, microneedling is a huge thing that we can do, especially for scarring. We have the regular microneedling and then Morpheus, which is the microneedling with radio frequency. It is incredible for scarring, stretch marks, tightening of the skin. So it's really good to have those options post-op because that is a concern, right? You want to, especially not only with breast augs, but say tummy tucks and things like that. You're going to have scars, but you're wanting to better your body and you want to look your best. So we have options even after the surgery.
And we use silicone-based scar gels. Maybe the only thing scientifically proven, at least in the early going, with all the scar gels on the market, is something that contains silicone. Which is ironic.
Yes.
But we use silicone gel, we can use silicone tape, and it tempers that immune response and makes sure that collagen lays down in a little finer, more linear manner. The scar is obviously going to be red and raised and thick for the first few weeks, and then it starts to flatten and soften and become more skin colored again by about the 6-month mark. So I tell most patients that if the scar isn't where they want it to be within 6 months, then we have a lot of things at our disposal, from the microneedling to the Morpheus to laser therapy to injecting steroid to try and temper that response and flatten it out more.
Yeah, I actually had a friend who had a surgical procedure, not plastic surgery, just regular surgical procedure done, and she had scars on her abdomen. I was like, you need this. You need the Silogen.
Yeah.
Here you go.
Yeah.
And some of them have SPF in it, which is great, especially when you're outside, because I mean, the sun will change a scar real quick.
Yeah.
For sure.
So
That's not a good
making
thing
sure,
for a scar.
making sure that sunscreen's in there.
You're
is
right back
really
to the
great.
sunscreen.
Yes.
Last one, now
Yes. Listen, sunscreen is
You
life.
just need to like market it, or you need to get some kind of like commission on
Yeah. Listen, if we could all just wear sunscreen, it'd be a better world.
this. I know, but it keeps you in business.
Yeah.
You know?
Yes,
So,
it does.
Yeah, that's so true. I wish so much like I had these options like when I did mine originally. I feel like
Me
I went in
too.
so blindly, which is good. I mean, it all worked out great. But
Yeah.
it's just nice that we have the resources that we have. And like as far as any limitations, like once you get implants, obviously we already confirmed you can get your mammograms and all that's normal, but is there anything you can't do like once you get breast augmentation?
I mean, I've had patients who are competitive athletes and they're on stage or they're playing professional sports, and patients are always back to full go. So that's assuming there's a normal, natural recovery. And there are patients who get a little off track, and we fortunately have the experience to help them if that becomes necessary as well. But those are few and far between, and by the end, everyone gets back to what they were doing before.
I know, I'm always pleasantly surprised just how quickly breast augs recover. Like usually we just say it's a long weekend and you're pretty much back to like normal activities. And they're like, what? I'm like, yeah. I'm like, you have a sedentary job. It's literally a long weekend. Yeah. I mean, if you're more active, obviously we have to make, some kind of plan around that, but it's all very doable.
In fact, some of our patients, because we use the ERAS or the enhanced recovery after surgery, which really decreases any sort of discomfort, we have to encourage them to slow down.
Yeah,
They don't want
exactly.
to do too much, so that's a different issue.
Agree. So one of the things that I love seeing with our patients, and I am blessed to be able to work with them like side by side with you, is I get to see them after, which you don't get to see them all the time,
much,
like
yeah.
especially like 3 months out, and like when they're fully healed and they're just like loving the results. And they're always like, I knew physically this would transform me, but I didn't know like emotionally and psychologically how much it would transform me and how this bothered me all the time. And I just didn't feel confident or I didn't feel like myself. And now that I've done this, I have more energy and I want to work out and I feel confident to go to the gym and I want to lose weight. And it's amazing. You've probably seen that too. And I mean, you've probably met some patients like that as well. But.
Yeah, I think it oftentimes will kick off a series of really positive changes, patient's whole outlook on life. But just the things you mentioned, exercising more happier when shopping for clothing, just the way things fit, more confident with partners, whatever the case may be. It just is, it can change across many different forms of the patient's life.
It can also break the bank when you want to go buy all the new clothes because you how they all look. Because you actually like feel confident in them. So that's like not such a great thing if you don't have that in the budget. Be mindful of that. Like save a little extra for the new clothes that you're gonna want to buy afterwards. But you save on bras. Yeah, like you don't need the like $80 Victoria's Secret bras anymore. You can wear actually a comfortable bra and you look amazing, or no bra, and just get those little sticky things.
Yep.
It's awesome.
I haven't bought a regular bra in like 6 years.
It's amazing. And yeah, you don't.
They're so uncomfortable.
I know, 1,000,000%. That was a game changer and unexpected.
Yeah,
but you do save money on bras.
See,
you can buy the cheap like $20 for 3 of them on Amazon.
Yep.
Yeah. So, see, changing the world. One breast dog at a time.
Get a breast dog, change your life.
People money, like, come on.
It's so true though. It really does. It opens so many doors after you get one thing done for yourself. You realize how much better you feel after you did that one thing. So you're like, well, what else can I do? Like, I want to, I finally have the confidence to maybe go do X, Y, and Z. And that made me feel better. So I want to do this now. And this makes me feel better. And I want to go see a functional medicine doctor because my doctor won't listen to me. And
I can't tell you how many times that happens. How many times when somebody comes for an AUG, they're like, oh, what about while I'm in here, what about my stomach? It happens all the time.
Yeah, I think a lot of patients realize that once they fix something and kind of get through that process and are really pleased, it might lead to something else. I think there's also a fair number of patients who's just kind of one isolated issue and they take care of that and they're thrilled and they move on, and I think that those changes often aren't sequential with surgery as much as making those changes in their lifestyle too. And kind of, it's a pleasure to see patients go to see you preoperatively, but then postoperatively to say, gosh, I feel so much better about this. Now I understand I can make these other changes too.
But also on the flip side, you don't operate on everybody.
Yeah.
And so I like that you, both you and Dr. Seifert really, kind of look at motive. Like if someone just really they don't feel confident and they want breasts, like great, then that's a perfect candidate. But I think some people, their unhappiness might run deeper. And I think you guys are both really good at identifying that, and you'll kind of veer them towards functional or talk to them about other things. And I don't think every surgeon, I'm quite confident that most surgeons don't do that. And so I appreciate that part of it.
Well, it's definitely a two-way street. When patients come to see us in consultation, they're interviewing us to see if it's a fit, but we're interviewing them to see if it's a fit. And there are some patients who just might be a better fit in a different office or might be a better fit not having surgery at all. And I think it's important to let patients know that because we're trying to hit home runs. We're trying to make real positive changes for people. And if it's just not going to solve that underlying concern, that root cause, as you would say, then it doesn't make sense to treat it some other way. Yeah.
I agree. And like you said, the flip side too, if you'll always like let me know if somebody's in the your office and talking about how, gosh, I just haven't been able to lose weight, so I really want to get this tummy tuck now because of this. And you're always like, I think you really need to see Dr. Weston, maybe start there. Let's figure out what's going on. And then so you're just really honest about that, and it's nice that we have those resources in our office to like offer that to people as an option.
And then it's so much better to have the cherry on the sundae when after they're done, then they have
That's right. Yeah.
Yep. 1,000,000%.
And I think also we have a lot of trust in our team at large. And so it's a message to patients out there that if they're mean to the front desk or if they say something to you that isn't sitting well, that's going to get back to me, and ultimately I think it's not a fit. So it has to make sense for our team as well as for me and for the patient.
1,000,000%.
So what do you guys think? At the end of the day, can a natural lifestyle and plastic surgery coexist?
Absolutely. I mean, I think it really comes down to each individual patient. Everyone's definition is different. Everyone's goals are different. And so I think for some patients, maybe not. For others, absolutely. It's a personal choice, and everything has pros and cons. And I think if we live by the adult code, we inform patients of the potential risks, and we inform patients, usually it's obvious what those potential benefits will be, and let them make an informed decision. So,
Yeah.
Most of our patients are young, healthy. They want to be healthy. They just want wellness in general. And so I think they really go hand in hand.
yeah.
Absolutely. It's all about being the best version of you.
Yeah, being confident.
Yeah. All right, guys. So thanks for sharing your perspective on, can natural and plastic surgery coexist? I really appreciate it. And I'll be sure to tell my friends everything that we talked about. It's just great. So I'm just so blessed to be able to work with all of you and just so educated and just open-minded about all these things. So,
Well, thank you so much for coming.
Yeah.
And I hope you can come to another one.
Yeah,
I think our next
absolutely.
one, I think we should talk like aesthetics. I mean, we haven't done that yet, right?
Oh.
Right.
Little Botox,
do it.
filler, lasers.
yeah,
all the things.
non-surge.
I
Sounds
love
good.
it.
Let's
I love
do
I think
it.
that's a great segue. You're going to totally be part of that one.
Oh,
Oh, yeah.
you know it.
I love it. Well, cheers to the next
Cheers.
one.
Cheers.
I hope you feel as informed and empowered as I do, getting answers to those big questions on breast augmentation. And we got plenty more answers to come. Join me next time on Asking for a Friend, where we'll get answers to top questions on fad diets, beauty gadgets, and longevity hacks. And the beauty gadgets is hilarious, by the way. What really works and what you should start doing today. And if you like what you heard today, don't forget to hit subscribe, share this episode with others, and follow us on social media, of course. Until next time.